Sir, just give us 1 minute.
Yeah,
Amit sir, can you please introduce the sir so
yeah,
that we will
yeah, yeah,
start?
yeah, definitely. So good afternoon to all the participants. So today is the first lecture of this, or we can say the opening lecture of the renowned veterinary ophthalmic surgeon, Dr. Suresh Kumar Jirwal. So firstly, I would like to I would like to share a brief introduction of him. So Dr. Suresh Kumar Jirwal have many achievements. I would like to count one by one. That the first, he is the first faculty of Rajwas Bikaner to be bestowed with the state level award by the government of Rajasthan State for excellent services in the field of veterinary ophthalmology. And he is awarded by the district collector Badmer Rajasthan in the year 2001 by district administration and Bikaner in the year of 2018. He became the first veterinary surgeon of Rajasthan state to perform successful cataract surgery for the phacoemulsification method in dogs. He won the 3 consecutive gold medals for his best papers at the annual Congress of Indian Society of Veterinary Surgery during the 2017-19. Facilitated with the Vice Chancellor Award for getting recognition as a veterinary ophthalmologist, become first veterinarian to be invited for the training with human ophthalmologist by the help of Help Me See Mumbai on AR/VR mode. Performed the ocular surgeries on loin at Machia Biological Park, Jodhpur, and at the Sajangarh Biological Park, Udaipur. He has guided 19 students for their master's research and 2 students for PhD out of 15 research have been conducted in the field of ophthalmology. So he has 103 scientific publications to his credit and attended many conferences, symposium, workshop of national and international report. He has been honored to be invited as an expert to deliver offline as well as online technical lectures, webinars on different topics for the veterinary ophthalmology and delivered more than 30 lectures. Besides this achievement, he has considered expert in cataract surgery for the phacoemulsification, first veteran invited for training in human ophthalmology, as I have told earlier. So after this, I would like to request Dr. Jirwal sir that he please address our participants and please start your valuable lecture so that they can be benefited, sir. Jirwal sir.
Thank you. Thank you very much, sir. First of all, I would like to thank to the organizing team for inviting me here for this online lecture in this very prestigious refresher training course and national refresher training course. So thank you very much to the organizing committee, and I have gone through the brochure of this national refresher training course, and this has a very wide arena that most of, I think almost every aspect of veterinary and veterinary science and animal science has been covered, and I'm feeling honored to be invited for delivering the opening lecture. And regarding my lecture, the title is Current Concept of Diagnostic Approaches for Ocular Affection in Pet Animal. Hello, am I audible now? Hello, am I audible? Hello.
Yes, sir, you're audible.
Yeah, please. Because I'm only my slides are visible to me, and none of the other participants are visible to me. I think I have done some in presentation mode, so only my slides are visible to you. So regarding ophthalmology, I would like to narrate that in veterinary science, ophthalmology is still, it's not that much developed, and with the advancement, in human or veterinary ophthalmology, there's a lot of advancement, and they are, advancing like anything, and they are developing new instrumentations, new techniques, and every year something new is inducted into medical ophthalmology. But still, we are lagging behind to medical ophthalmology. But thanks to the development of the state-of-art ophthalmic gadgets that veterinary ophthalmology is now pacing with a good speed. And these high-level instruments that are now available for veterinary purpose also, they have altered vision care, analysis, and treatment, essentially for a huge number of farm and companion animals all around the world. And we know that the importance of eyes is, we well know that how the eyes are important to us. Likely they are important for various species of animals also. And we as veterinarians are fortunate to handle, a lot of species for their ocular affections. So you can see here that there are a lot of, species, and we used to handle all the species for their ocular affections. As I narrated that veterinary ophthalmology in India is still in infancy, because when a veterinarian is passing out for his graduation degree, with his graduation degree, he is little bit exposed to the ocular affections. Hello, is there any disturbance? And he is least experienced for the most common ocular emergencies, because most of the time, most of the clinics, they are not getting the ocular affections because it's not in routine practice for them. Then the secondary thing is no official super specialization in the field of veterinary science in India. And that's why most of the people, most of the pet parents, they are unaware of the facilities that some of the specialized centers are having with them. However, nowadays, this veterinary ophthalmology is in high demand, and most of the pet parents are visiting to the clinics and veterinary universities, hospitals, everywhere, and searching for remedies for their ocular affections of their pets. We at Rajuvas, we are performing a lot of activities at Rajuvas, and we are performing cataract surgeries, all types of diagnostic techniques for ocular affections in pets. We are also doing electroretinography, that is for evaluation of the photoreceptor cells in the retina. Then we are also getting on the intraocular pressure measurement cases, and we are doing this with some non-contact tonometer also. Then besides this, as I told you, that now veterinary ophthalmology is in high demand, and a lot of people are approaching to us for delivering the lectures in respect with the veterinary ophthalmology. Some of the platform that we have been fortunate to visit is the prestigious BIT Pilani. They have organized some laboratory animal ophthalmology trainings. They have invited us. Then many private practitioners all over the India, they are inviting to train the veterinarians at their level. Then we have also introduced one book, Cataract Surgery in Dogs, that is available on Amazon also. Besides this, we have also extended ophthalmic services to wildlife also, national wildlife centers and zoological parks in Rajasthan, and in Bhubaneswar also. We have examined one elephant for cataract surgery, and we have been fortunate to successfully perform this rare cataract surgery in an Asiatic lion at Machia Biological Park, Jodhpur. Besides this, we have been at the Center of Indian Knowledge System, IIT Guwahati, for to deliver a lecture during an NCGV National Conference on Go Vigyan. And many CV program conducted at Telangana, Hyderabad, and at CSIR, IGIB, Delhi. Many prestigious institutes, they are inviting us to disseminate the knowledge of veterinary ophthalmology. That's how nowadays it's in high demand. And now this is the future of veterinary ophthalmology, where veterinary ophthalmologists will be trained by augmented reality and virtual reality on simulators, just like the human ophthalmologists are being trained. Just like that, very soon this simulator training will be available for veterinarians also. And as narrated by the organizing committee, recently on 26th of January, we were bestowed with the state level merit award. So this was a brief regarding the activities and our achievements, and we are trying to show that how this veterinary ophthalmology is gaining popularity day by day. Now, moving on to the topic, you can see the beautiful eyes. The language of eyes is always universal, and we may not understand each other's language, but can understand what we feel for each other through our eyes. You can see the beautiful eyes. So if we have an habit of peeping into others' eyes, we develop healthy relationship also. And if these beautiful eyes appears to you beautiful as these eyes, I think both these eyes are appearing beautiful to us. And if we develop a habit of peeping into these eyes, and certainly we are going to become very soon veterinary ophthalmologist. Ocular health, if you talk about ocular health, it has been of great concern since time immemorial, and in Sasrat Samhita also it has been elaborated about 76 eye diseases, of which 51 were amenable to surgical treatment. Some of the affections that have been narrated in that Sasrat Samhita are glaucoma, then uveitis, cataract, and trichiasis. These have been already mentioned, in this Sasrat Samhita. And in addition to this, we have also seen that in that Sasrat Samhita, intraocular cataract, intracapsular cataract extraction have been also demonstrated. So it's very old for human beings, but in veterinary it has been developing nowadays very fast. Now if you talk about advances in small animal ophthalmology, then it can be nowadays it can be attributed to increase in number of pets. Nowadays, we have seen that in metro cities, every person may not be having in a family, if they are only husband and wife, they are having at least 1 or 2 pets. Every family does have pets. So with the increased number of pets, number of veterinarians is also increasing, and also increasing the number of veterinarians, those who have started practicing for veterinary ophthalmology. And this has been enhanced with the development of technologies for diagnosis and treatment of ocular affections. Nowadays, many handheld instruments are available for diagnosis of ocular affections in pets. And we have seen that in human beings, most of the diagnostic equipments are on desktop, tabletop, and that are not that much useful for human beings. But now handheld instruments are available for pets, and they can be easily used with having the basic knowledge of using them. Then besides these such kind of programs, CV programs, as this kind of refresher trainings and all, they are organizing to create awareness among the pet owners and even the veterinarians also. But for using all these advanced technologies and all these instrumentations, we need to have some basic knowledge of applied anatomy of the eye. And I think this is not the right platform to want to get one-to-one. So I will just like to show that this is gross vision, gross of the eye from outside, that you will see here the structures, pupil, then iris, then the eye have two canthus, medial canthus and lateral canthus, then conjunctiva over to the sclera, then third eyelid. All these structures you have to be equipped with the basic knowledge. You have to have the basic knowledge to use the techniques and to diagnose. Then this is again, you can see here the different parts, cross-sectional view of the eye that is showing the optic nerve at number 1, then number 2 optic disc, number 3 fovea centralis, number 4 is the retina, then comes number 5 is sclera, number 6 is choroid, number 7 is ciliary body, number 8 is the lens, number 9 cornea. Here you can see at number 9 it's cornea, then it's pupil, 11 is aqueous body, 12 iris, suspensory ligament, and vitreous body. So this is the basic structure that every veterinarian have to have this knowledge to discuss and to make a exact diagnosis. You have to have the knowledge of anatomy. And if you want to categorize the ocular pathologies, they can be categorized as into different segments: anterior segment, posterior segment. And if you talk about the anterior segment, then it is consists of mainly cornea, then aqueous humor. This is, you can see here, cornea, then this aqueous humor, then this one is iris. You can see here iris, then pupil. Here you can see the pupil, then ciliary body. This is ciliary body, lens, and trabecular meshwork for drainage of the access of the aqueous humor. So this is all included into the anterior segment of the eye. Now, if you talk about the affections of anterior segment of eye, then they are usually seen in both small and large animal, and the common affections that we usually encounter are dry eye conditions, then different kinds of infections, trauma of various eyes and inflammatory reactions, hereditary disorders, and the most important one is the cataract. And nowadays we are getting a lot of cases of cataract, and you can say that cataract is the only affections that have miracle effects after the surgery. As soon as you remove the cataractous lens, implant the intraocular lens, the dog will have the same kind of vision that it was having when the eye was very much healthy. So as to there are, as a rule, it has been said that there is continuous progression and aggravation of symptoms leading to varying degree of visual loss with or without pain in the anterior segment. And cataract and loss of corneal transparency are still the two most common causes of blindness. Now, we are getting a lot of cases of this kind of affections. Now, if we talk about the posterior segment of eye, then posterior segment consists of vitreous humor, then retina, optic nerve, choroid, and sclera. And if we talk about the development of ophthalmology, veterinary ophthalmology in regard with the anterior and posterior segment, I would like to narrate that the affections of anterior segment, as you have seen here, are easily treatable and easily can be diagnosed and easily treatable. However, the affections of posterior segment, if we talk about the affections of posterior segment, we are still lagging behind in treatment of retina, optic nerve, and choroid, and we still have to develop many techniques for this. However, in some of the centers, those who are practicing advanced veterinary ophthalmology, they are treating all these kind of affections also. And usually the posterior segment affections of the eye are this persistent hyaloid artery, then vitreous degeneration, intravitreal hemorrhage, vitreal cyst, then retinal detachment, retinal dysplasia, retinal degeneration, then progressive retinal atrophy, pigmentary chorioretinopathy, and chorioretinitis. So all these kind of affections are encountered, but if we have some technology with us, we can treat. Otherwise, we have to let it go. Then you see in this slide, why does this dog end up in this situation? You can see here, this kind of images, my dear friends, they show that if every veterinarian have the basic knowledge regarding the ocular affections, such kind of conditions can be treated at the early stage. This is a case of dry eye, but because of lack of basic ophthalmological knowledge with the local vet, or unwilling to consult any specialist, or lack of confidence, so this kind of condition will develop. This is a simple case of dry eye, and if had it been treated at the early stage, we would have saved the cornea. So for this kind of conditions, what you need is confidence building. You should have the basic knowledge, and for confidence building, the basic thing is preparation. Preparation is the key. We should be prepared for such kind of affections, for such kind of ocular affections, that yes, next time if this affection will come, we will certainly treat. And for this, preparation is the key. Just like you see here, this tiger is ready to pounce upon the prey and is ready to prey, and he has prepared this thing. So just like that, you have to practice it, practice for the ocular affections. And for this, you have to develop a habit to gaze through the window of the eye. You have to examine the healthy eyes in a routine way. Every veterinarian should try to look into the eyes of animal, even if that is presented to your clinic for some other affection, not with some ocular affections. Then you should come to know what's the healthy eye look like. Every time if you look for a healthy eye and you come to know, yes, this is the normally healthy eye, then the day you encounter any abnormality in the eye, you can easily diagnose, because eye, it's readily, you can make the diagnosis very readily. Even by the gross examination, you can diagnose, yes, it is a case of cataract. Then most ocular structures, we have seen that they can be visualized either directly or indirectly. Most of the time, gross examination is very much sufficient for diagnosing the cases. Then ophthalmic diagnoses are often made at the time of examination itself. You need not to go for most of the time, you need not to go for CBC and some advanced hematobiochemical examinations. Then what to look for when you are looking into the eyes and you are examining a case of ocular affection, what to look for? These are some of the points that you should always look for. Decreased vision or blindness, you should always ask the owner, the pet owner, regarding the history of bumping into the wall, or how long this vision loss has been there. Then is there any kind of ocular discharge? You should always look for that. Is there any change in ocular color? Is there any manifestation or any symptoms of pain, ocular pain? Is there any opacity or any film over the cornea? Is there any pupillary changes? And the eyes, enlargement or exophthalmos eyes, they are always should be looked for. These, these complaints form the basis for the problem-oriented approach to ophthalmology. This kind of, you can see here that the pupil is completely dilated, and here you can see a lot of mucoid discharge. So such kind of discharge should always be noticed. Here you can see the change in color, eye color, change in iris color, but usually you should have the basic knowledge that this is many times, this is a normal phenomena. In, say, for example, you can say in huskies, this is very much frequent that they have two eyes have two different color of the iris. Then here you can see the sign of pain in this eye, blepharospasm. This is known as blepharospasm. This is a frequent sign of ocular pain. Here you can see that the pupil is dilated and changed in the lenticular color, the case of cataract in cat. Here you can see that both the pupil are not normal, not same. Here you can see dilated pupil, and here it is miotic pupil. Then you can see exophthalmos enlarged eyes, the intraocular pressure is increased. Then the basic ophthalmic examination procedures one should be aware of. There are certain basic examination procedures like gross examination. You have to look grossly to the eyes, then Meniere's response test, obstacle cause test, corneal reflex test, then PLR, pupillary light reflex test, STT, Sirmer tear test, then FDT, fluorescent dye test. What you need for ocular examination, what you need is a room that can be completely darkened. The first and the primemost thing required for ophthalmological examination is a completely or semi-dark room. Then you need a this type of trans illuminator to focus the light onto the eye. Then you need some magnifying loops. Then these kind of strips are available in the market. These are Sirmer tear test strip. These are fluorescent dye test strip. Tonometers, different kind of tonometers are available in the market. Some are directly touching to the cornea, and some are non-contact tonometers. Then you need certain drugs that are used to dilate the pupil for examination of the fundus. If you want to look at the fundus, then you should, dilate the pupil. Then this one is topical anesthesia, and this one is tropicamide to dilate the fundus. Then you need some fine forceps to hold on to the sclera and different parts of the eye. Then certain kind of swabs, ophthalmoscope, direct and indirect ophthalmoscope, and slit lamp. So these are, if we say that besides this direct indirect ophthalmoscope and slit lamp, all these are basic instruments that one should have for a ophthalmological diagnosis. And now if we talk about this gross examination, if you talk about the gross examination, you see that, as I told you many a times, the diagnosis is made on gross examination itself. Now here you can see, if we say what the affection is, you can say that this eyeball is popped out, and this is known as proptosis. Here you can see that there is a wound at the lower eyelid, and this was a case of myiasis, that means maggot wound in the lower eyelid. Here you can see that the cornea is ruptured and the lens has been protruded out. Here you can see that lot of corneal opacity, complete cornea is opaque. Again, you can see lot of opacity in the cornea. Then this kind of affections, you can see the dermoid hair in the eye, hair or the cornea, you can see here. Then this kind of affections, they are known as cherry eyes, lot of cherry eyes here. So all these can be diagnosed at the time of gross examination itself. Besides this, other neuro-ophthalmological examinations should also be performed, like Meniere's reflex test. This is also known as MRT, and this is a normal test to check the intactness of sensory pathways of trigeminal nerve and motor pathway of the facial nerve. And if in this type of examination, what we do is we just create a menace or a threatening effect towards the eye of the animal. And if that animal blinks the eye and tilt the neck, that means it is having vision. Otherwise, the eyelids will be apart. You can see here in a negative Meniere's reflex test, you can see that any of the Meniere's reflex does not cause any blinking or any kind of response. That means this dog is completely blind. So this is the basic test for vision, that the dog have vision or not. Second one is obstacle course test. Here you can see that I will show the two videos, pre-operative and post-operative videos. And in pre-operative video, you will see that the dog is bouncing back. You will see here that this has bounced into the object. And this one is post-operative, and here you will see that it is clearing all the obstacle very smartly. So this also gives you an idea that whether the animal is having vision or not. Now you can another test, neuro-ophthalmological test, is CRT, also known as corneal reflex test. So in this test, what we are doing is we are making a wisp of cotton and touch to the cornea. And if the nerves innervating to the cornea, they are functional, then it will certainly blink the eye like this. And this gives a positive corneal reflex test. That means the nerve innervation is working perfectly. But here you can see in a negative test, you will see that this does not give any response to the wick touching to the cornea. Now, why this test is important is very, it's very good to know that if the test is negative, that means it does not blink the eye. That means in time to come, it is going to develop dry eye, because we know that when our eye is in stress or the cornea is becoming dry, it will send a message to the optic nerve, to the visual center in the brain, that you should blink the eye and maintain the corneal film over to the cornea, tear film over to the cornea. If the tear film is not over to the cornea, then it's certainly the eye has become dry, and in time to come, if the nerves are not responding, it will become into a dry eye case. Another one is PLR, pupillary light reflex test. Again, this kind of test is to check the photoreceptor cells in the retina, and if the photoreceptor cells and the iris muscles, they are working properly, then this will give a positive reflex. There will be constriction of the pupil, and if it is negative, that means the photoreceptor cells are not responding, then it will be in a dilated form. Now, here you can see, as I told you in previous slide, also one of the previous slide, that the dry eye or the case of advanced KCS, it should be diagnosed at the early stage. Here you can see that it is healthy eye. This one is healthy. This one is early KCS. That means there is loss of tear and cornea is becoming dry. Then this one, opacity started, neovascularization is started. This is intermediate KCS, and ultimately the cornea cracks will develop into cornea and thick mucus. There will lot of infection will be there, and this has become an advanced case of KCS, and now it's very hard to treat it. So it should be diagnosed at the early stage, and for its diagnosis, the test is very simple, and that is known as Sirmer tear test. We simply used to have this kind of strips with us, and every time the dog visited to you, you should put these strips into the lower conjunctival fornix and watch for about 1 minute. If the wetting, you can see here, this is impregnated with the dye, and if this dye wetting shows you between 15 to 25 mm per minute, that means it's having a normal tear film, it's having normal tear production. Then if it is 10 to 14 mm, then you can suspect for low tear, and if it is less than 10 mm, then it is inadequate tears. And my dear friends, if it is less than 5, then you can certainly say that this is a case of dry eye. So just like Sirmer tear test, another test that is very useful is fluorescent dye test. You can see here the fluorescent dye test. it should also be performed to see any injury over to the corneal epithelium that are usually, goes undiagnosed, and every case of epiphora where there is a lot of tear production into the eye, that should certainly be diagnosed with the fluorescent dye test. And if this dye is give a color to the corneal epithelial layer, then certainly this is having ulcer. Otherwise, you see, if the epithelium is intact and have no injury over to the epithelium, then this cornea will appear like this. No stain will be retained by the cornea. Now, these were the basic neuro-ophthalmological examinations. And now, if we talk about some advancement, then some advanced imaging system is also being used in veterinary ophthalmology. Like, however, if we say ophthalmoscopy and tonometry and this slit lamp by microscope, these three are now have become very much common, and every veterinarian is, those who are dealing with the veterinary ophthalmology, they are having these three instruments in common, and they are using it very frequently. But besides this, if we talk about this ophthalmic imaging, every veterinarian is not doing ocular ultrasound. It should be performed. Then ERG, electroretinography, another advanced test. Then MRI, magnetic resonance imaging. Then pachymetry, scanning laser colorimetry, or OCT, optical coherence tomography, and fluorescent angiography. These are some of the advanced ophthalmological examinations that should be made if the facilities are there. Then fundus photography. Last one is fundus photography. This can also be performed. If we talk about ophthalmoscopy, then there are two types of ophthalmoscopes. This one is direct ophthalmoscope, and this one with a headpiece and a 20D. This one, this assembly, complete assembly, is known as indirect ophthalmoscope. And if we talk about the direct ophthalmoscope, then for direct ophthalmoscopy, we have to go very much near to the cornea. And I think this is a disadvantage, that you are always at risk. So one should always secure, one should always restrain the mouth before going so much close to the dog. Many times you will see that dogs are very friendly, and owner will say that my pet is very friendly and it never bites. But you know that this time, you never know that this time may be your chance that he should bite you. So always make sure before going very much close to the eye, because when you are examining by direct ophthalmoscope, you are very much close. So you should always put on a muzzle over to the mouth of face of the muzzle of the dog. And this, this provides a comprehensive view of the cornea, iris, and lens. And many times you will diagnose these corneal foreign bodies, abrasions, corneal disorders, and by this ophthalmoscopy you can evaluate complete anterior complete anterior segment, and you can move up to the fundus, even lens opacities and fundus also. And for indirect ophthalmoscope, what we need is a headpiece and a 20D. It should be in between your eyes, that means the headpiece and the eye of the pet. This is how it is performed. If we talk about tonometry, as I have told you, there are many kinds of tonometer. This one is contact tonometer, also known as COS, the basic tonometer, also known as COS tonometer. Then now there is this kind of tonometers are available. These are having some magnetic impact, and they just, they are having a probe that strikes to the cornea and return back. And this one is a non-contact tonometer that throws a puff of air to the cornea and measures the intraocular pressure. And this technique is basically also used in human beings tonometry also, where there is a desktop tonometer where you put your chin over to it, and all of a sudden a puff of air will strike to your cornea and the intraocular pressure is measured. Second one is next is slit lamp examination. This slit lamp examination, this helps in determining the depth of the ulcer, then abrasions or corneal dystrophies, and the location of vascularization and corneal deposits. This slit lamp provides oblique illumination, and by this oblique illumination, you will get different slits of cornea, then anterior segment, that means aqueous humor, and of the lens, and it can detect minute corneal opacities and exactly localize the lens changes. Now here in this slide you can see that there are 3 slits visible by the slit lamp biomicroscope. The first slit is for cornea, then this one is for anterior chamber, aqueous humor, and again this one is for the lens. So by this you can diagnose every minute changes in either cornea, anterior aqueous humor, or the lens. Next one is USG, ultrasonography. So usually the most commonly we are using is V mode ocular ultrasound, and in cases where the posterior segment of the eye is not visible because of either opacities over to the cornea or into the lens, then if the cornea is opaque, then you will not be able to see even the aqueous humor and the lens. And if the lens is opaque, then you are not able to see the vitreous humor and the fundus. So in such cases, to diagnose any ocular affection of the posterior segment, you need to go for USG, and this USG can be easily performed in awake animal. You need not to give anesthesia to the dog, and simply it can be also done in standing position, and this kind of images are received. And here you can see in this is the normal USG of the eye, where you will see the hyperechoic 2 lines of crescent of the cornea. This one is hyperechoic cornea. Then it comes the aqueous humor. Then you will see there are 2 hyperechoic images. Here it is anterior lens capsule and this is posterior lens capsule. And in between you see there is anechoic area. That means this lens is healthy and having a gel-like structure, and it will appear as anechoic, and thus beyond the vitreous will also appear anechoic. Now in cases of cataract, if the lens is cataractous, you will see that this will become hyperechoic, and some patches of anechoicness will be seen. Otherwise, the cataractous completely mature lens, cataractous lens will appear as hyperechoic image. So you can easily diagnose. And this one is the optic disc, and this one the area for optic nerve, the hyperechoic area. Then these are the ciliary bodies and iris. All these things are there. So if you are using this ocular ultrasound, you can easily diagnose the affections of posterior segment in case of opacity of cornea and the lens. As I have told you, the different indications of ocular ultrasonography in case of opaque cornea, then hyphema, that means nothing visible beyond this aqueous humor in cases of cataract. Then to differentiate between solid and cystic masses, here you can see you have to do the USG to determine the extent of intraocular masses, and to measure the diameter of globe in animal with suspected chronic glaucoma, you need to go for USG. Here you can see a good image of ultrasound, ocular ultrasound. Here you can see the schematic diagram of the eye that shows cornea, and this is how the cornea will appear on USG, two hyperechoic line, and in between there is anechoic space. That means it is epithelium, this is endothelium, and this one is stroma. Okay, so this will appear as like this, and then the you see anterior aqueous chamber. This will fluid filled. This is fluid filled, and this will appear as anechoic structure. Then comes the anterior lens capsule, posterior lens capsule. Like here you can see anterior lens capsule, posterior lens capsule, and this one is lens. Okay. Besides this, this one is ciliary body. This is vitreous body. Okay. So this is how, if you are aware with the normal structure of the ocular ultrasound, you can certainly diagnose any abnormality into the eye. Next one, next advanced technology, next advanced diagnostic technique is ERG, also known as electroretinography, retinal electroretinographic examination. Then we were using this kind of amplifier or for doing this ERG, electroretinography, and these are different instruments. Eye speculum that should be used to keep the eyelids apart. Then this one is active electrode. This is placed over to the cornea by using a coupling gel. And these are reference electrode, and this is ground electrode. This is how it is positioned, and this is how the kind of waves we will be getting onto the our screen for which we are diagnosing, for which we are doing the electroretinography. So this kind of A and B waves, they are visible. And my dear friends, it is just like ECG. In ECG, what we see, if it is PQRS, then it's normal, and as it comes to straight line, then the condition is gone. Patient is gone. Just like that, if you are getting A wave, B wave, and all these things are there, then it's a normal retina. Photoreceptor cells are working properly. And if there is a straight line, then you can say the photoreceptor cells are gone, the retina is gone, and the prognosis is very much grave. Now, as I told you that with the change in technology, fast change of technology, you see, initially we were doing ERG like this, and now it is usually being done with handheld ERG machine, and very readily, very quickly it is performed for the veterinary patients also. Now such kind of machines are available, so you can see, you can witness the change in diagnostic techniques has changed the way the cases of ocular affections are being diagnosed in veterinary. Then MRI is also being used, and just like human beings, it is being performed, and it will show some, you can see here this exophthalmos caused by retrobulbar. You can see here a lot of retrobulbar mass. Retrobulbar is space occupying lesion, SOL is there. So this could be tumor or an abscess. So such kind of affections, in every case of exophthalmia, you may go for radiography, and even we can go for USG also, but these are some advanced techniques, and it can diagnose, and it can also provide excellent detailed images of brain, then optic nerve and surrounding structures, which can help to identify the underlying causes of vision loss. Usually you will see that in many a case, when we are going for ophthalmological examination and we diagnose that everything up to the retina is normal, okay, cornea is okay, then aqueous humor is okay, then lens is okay, vitreous body is okay, and even the photoreceptor cells in the retina, they are responding very well. Even then the animal is blind. So in such cases, MRI is very much helpful to locate the lesion, to locate exact lesion of the vision loss. Usually the conditions like brain tumors, optic neuritis, and inflammatory diseases, they can be easily diagnosed with the MRI. Then pachymetry. It is used to measure the thickness of the cornea to track the evaluation of corneal diseases like corneal edema, dystrophies, and keratoconus. Moreover, this pachymetry is sometimes also helpful in giving the prognosis of cataract surgery. In many times, it happens that the cornea become very thin, or the endothelial cell layer is very thin. So in that cases, the chances of corneal opacity are more. Then this is specular microscopy. This is also, as I told you, to see the normal endothelial cell density. You can see this one is normal endothelial, and this one is very low density, and this is a high surgical risk patient for cataract surgery. In such cases, if we are performing cataract surgery, then certainly there are chances of getting endothelial damage, and ultimately this will lead to permanent opacity of the cornea. So this should also be performed before going for any kind of surgery for the cataract. Then OCT, just like in human beings, this gives a cross-sectional image of the retina to see the different layers of the eye, and it is usually helpful in diagnosing this age-related macular degeneration, then diabetic retinopathy, and glaucoma. This one is fluorescein angiography. Fluorescein angiography is usually used to examine the vascular component of the fundus as well as the anterior uvea. That means this iris and ciliary bodies and all these things. So here what done is sodium fluorescein is injected by intravenous route, and his retina is illuminated with blue light. And if it will give such kind of structures, and here you can see a case of microaneurysm. Everywhere you will see the blood, it is showing the fluorescent dye in the sodium fluorescein in the blood vessels, but here no blood vessels are there. You can see here the aneurysm is, this is how the aneurysm is diagnosed, and it is usually used for the diagnosis and monitoring of conditions such as macular degeneration and diabetic retinopathy. Now, if we talk about this fundus photography, next one is fundus photography. You can see here that usually what we are doing is by direct and indirect ophthalmoscopy, we can examine the fundus. But for further evaluation of the fundus and for record keeping, it is very important that we should have a picture of that fundus with us, so it can be further evaluated for the diagnostic purpose. And many kind of fundus cameras are available, like this one is for human beings, desktop fundus camera. This is handheld fundus camera, but this cost, it ranges from 3.5 to more than 5 lakh for one fundus camera, and that is very costly. But now we have tried for some handmade, fundus photography using our smartphone fundus, smartphone cameras. We have used this for research purpose in camel, dogs, and even in cattle. We have performed this fundus photography using our smartphone, and we are getting good quality images. Here you can see that this is a optical tube, that is a plastic PVC pipe that should be used, and anteriorly the 21 diopter lens is attached to it, and towards your eye the smartphone is attached at its camera end. So this will give a video mode of the fundus, and further you have to take the screenshots out of those video shots. So many kind of retinal detachments and diseases of the optic disc, they can be easily diagnosed using this fundus photography. Then there are certain advances in surgical therapeutic management of ocular affections also. Just one or two slides I would like to show here, that in surgical management of glaucoma nowadays, transscleral cyclocryotherapy is widely used in veterinary also. Then Ahmedwal gonia implants is being used in a routine way for this glaucoma. Then diode laser endoscopic cyclophotocoagulation is also used. Then with the advancement of ophthalmological diagnosis and treatment procedures, diverse routes are also being practiced for this medication delivery into the eye. You will see different types of routes. Then certain for this type of burr keratectomy for indolent corneal ulcer, this kind of being used for debridement of the corneal ulcer. Then use of diode laser. Diode laser is also being used for removing single or multiple hair follicles in dogs. Then if we talk about advances in surgical therapeutic management, then again you can see use of diode laser for vaporization of pigmented tumor and iris cyst. This is being used. And in many cases of eyelid adenomas and ablating tumor tissues, this diode laser is used. And nowadays, you see such kind of treatments are being given very smartly. Here you can see a case of cherry eye. Initially, what veterinarians were doing is to resect it out. But now, with a lot of veterinarians, they are practicing veterinary ophthalmology, and this Morgan's pocket technique is used to repose this nictitating gland back into its capsule, and that's how they save this gland. Then cataract surgeries, no doubt, now it has become a routine, and it's very much advanced. And if we want to know the future vision of veterinary ophthalmology, then eye laser surgeries, just like it is being used human beings, very soon we hope that in future it will become a common practice for using this kind of laser surgeries, and corneal transplantation will also become very much common with time to come. A lot of veterinary ophthalmologists, when they start using all these techniques, it will become common. Then robotic eye surgery, this is also a dream come true for veterinarians. Just like human beings, they have started performing this robotic eye surgery, and we hope, my dear friends, that very soon we will be able to witness this robotic eye surgery in India also. Here you can see how this robotic retinal surgery is being done. Then gene therapy. Gene therapy is also being done in for treatment of many ocular affections. Then for correction of some damaged retinal cells. This is being used in human beings, but very soon I hope that this will be common in veterinary use also. AI, artificial intelligence, nowadays we see that this artificial intelligence has become very popular in different aspects of human life. So, and also being used for diagnosis and treatment of many ocular affections. And this machine learning and deep learning is also expected to be very helpful in making diagnosis and treatment of many ocular affections in time to come. Then to conclude here, my dear friends, the field of veterinary ophthalmology is, nowadays it is constantly evolving, and we are marching ahead with a good pace. Newer and newer technologies are being introduced for diagnosis and treatment of pet ocular affections. Many new veterinarians, they have started practicing it. Many good ophthalmic centers are established in India. One of them is IVET. They have many branches, Pune, Mumbai, and they are doing a great job. They are exclusively practicing veterinary. So this is high time that in veterinary field, this should be practiced it by and large. And as we continue to make strides in this field, our ability to enhance and preserve the vision of our beloved pet will improve. So with that, I think this is the last slide. So thank you very much, my dear friends. And I do have many other slides also to test your knowledge, but I think if there are veterinarians and it's one-to-one, then they can answer me. But online, I think I will not be getting response of this. With this, I conclude my lecture. Thank you very much. Over to you, please, madam.
Yeah, thank you very much, sir, for delivering such an informative lecture to our participants. And as an course director, I am feeling highly obliged that you spare time out of your busy schedule for delivering such an informative lecture to our participants. And I hope that our participants will be definitely benefited through the knowledge you shared in the field of veterinary ophthalmology. Thank you very much, sir. Thank you.
Thank you, sir.
Thank you. With this, we come to the end of this session, and I thank all the participants for listening with patience, and thank you to all the participants. And tomorrow morning session will start sharp at 11 a.m. So I request all the participants to be ready and join at 11 a.m. tomorrow. Thank you to all.
Hello. Arun
Yeah,
sir.
Hello. I'm Dr.
Sir,
Jagnesh.
can you share the material?
Yeah.
Yeah,
Surely,
sir,
I will share
this-
it with the organizing committee, and they
all
might
these, let me interpret. All these lectures are being recorded and will be shared in our group along with the
Okay, sir.
presentation of the PPT. All these lectures.
Okay. Thank you, sir. One of the
Thank you,
best
thank you.
presentation. Thank you, sir.
Thank you.
Thank you, sir. Thank you so much.
if
Okay, let
anybody
me
have
conclude this session.
if anybody have some queries and the organizers allow me to answer, I am ready to answer. I forgot that thing too. There are many veterinarians who have joined, and if they have any queries, I can answer their queries also.
Yeah. Participants, please feel free to ask any query if you have or any doubt. This is a very good platform for interaction with the experts. So please, participants, if you have any doubt, please ask your question. Okay, and if no doubt, then can we conclude this session? Okay, I think, sir, participants will first,
No
I think,
issue.
during the assignment, after assignment, I think they will share any problem, or we can share, even we will share your number with them